All right. Okay, so it looks like we are ready to start. Hello and welcome, everyone. Thank you for taking the time to join us today. I'm happy to see some familiar names and some less familiar names today. So I think we have some applicants and some offer holders already who have joined us today, but also some people who have showed some interest recently in our postgraduate certificate in medical and health education course. So it's really nice to see that mix of applicants and interest here today. So I'm very pleased to be joined today by a great panel of academics and a recent graduate from the online and part-time PGCert in medical and health education. And we are going today to be discussing how this course can boost your career. So we are going to start off with some introductions from the panel. And while we do that, I invite you all to add a message to the chat and let us know who you are and where you are joining us from. So we have an idea of who's there with us. So my name is Xavier. I'm one of the course advisor team here at the University of Manchester. I'm here to make your decision about studying at the University of Manchester as straightforward as possible. So I'm here to guide you through the application process and answer any questions that you might have right up until you begin your studies with us. So please feel free to contact me after this webinar, especially if you're watching the recording. I know that some people expressed interest in joining us today, but were unable to do so. So you can see my email address at the bottom of the screen. It's studyonline@manchester.ac.uk. You can contact me anytime and we can arrange a one-to-one consultation on Zoom or over the phone to discuss the course further if you have any questions. So don't hesitate to email me, I'll be happy to help. As I said, we are joined today by our course director, Dianne Burns, our deputy course director, Bipasha Choudhury, and by Dalil Al-Shamari, who recently graduated from this course, and who will be the student's voice. So I will invite them to introduce themselves so they can give you more background on their career and academic interest. Dianne, would you like to start?
Hi everyone, I don't intend to read off the screen what that slide says about me, but just to let you know that I'm a senior lecturer in the Division of Nursing, Midwifery and Social Work, specialising in leadership and management teaching. I am also employed in the Division of Medical Education, so the School of Medical Sciences. So part of my time is in the School of Medical Sciences and the other part of my time is within the Centre for Academic Development. So I sit across 3 different faculties or organisations, but that allows me to dip my toe into lots of things with regards to staff development. So yeah, I'm very privileged to be able to do that.
Thank you very much, Dianne. So I leave the floor to Bipasha.
Oh, thanks, Xavier. Hi, everyone. Lovely to see you. Hope you're all doing well. My name is Bip Choudhury. I work very closely with Dianne. I lead on the assessments part of the PGCert. I graduated with a medical degree from Manchester, worked in the NHS for a bit before I moved into teaching. So anatomy is my subject. I teach anatomy and histology to whoever needs to know it, which is a lot of people. I help out on different national platforms to do with anatomy. Anatomy is my subject, it's close to my heart. Yeah, and I've published a few children's books in anatomy as well. I hope that slide conveys my passion for my subject, not just anatomy, but education as well.
Definitely, thank you, Bip. And now, last but not least, Dalil, would you like to say some words about you?
Yeah, hi, I'm Dalil Al-Shamari. I graduated from College of Dentistry in 2018, and then I got my master's degree from University of Sheffield in dental public health, and I started my PhD 2020 in University of Manchester, and I got the postgraduate certificate as integrated with my PhD program, and currently I'm in my 3rd year of my PhD in dental health science, where I'm focusing on children oral health as my research focus. And also I awarded a Fellow of Higher Education last May.
Great, thank you very much, Dianne. So let's have a quick look at the agenda for today. So today we will start with Dianne and Bip, who are going to speak about what you can expect from our PGCert in medical and health education in terms of career, but as well in terms of the course itself, how it is structured. We will then have a time with Dianne, who will share more about her student experience, and at the end we will open things up to a Q&A. So once again, I encourage you to ask any questions you would have about the webinar topic, about the medical and health education course. Please use the Q&A function or the chat box to ask your questions. Any question is valuable to anyone, so don't be afraid. So if you are considering studying medical and health education with us, this webinar is an excellent opportunity to learn more about this online and part-time course and have any question answered. So without further ado, I will pass it over to Dianne and Bip for the next slides. Yes. To Bip, I think. Yeah.
Okay, so just to give you a brief history of our programme, it originated as a PGCert in teaching and learning and a PGCert in medical and health education, and we had the honour of being able to merge Bip and I, those two programmes together, and completely reconfigure the content and the delivery style so that it was very flexible and inclusive. So one of the unique aspects of this programme is that it just doesn't focus on medical education, but it's about healthcare education too. It was created in collaboration with the Royal College of Physicians Edinburgh, so that they were with us every step of the way, and it is now accredited by the Academy of Medical Educators, and that brings benefits, particularly for medics or dentists joining this programme that we'll talk about later. One of the other great aspects that we're really proud of is that our course is delivered by national and international leaders in medical and health education, and one of the reasons that we can do this really well is because the course is completely online, so we can tap into really experienced educators from across the globe, and that brings a really unique perspective to our programme. Our course content is directly related to healthcare teaching and assessment, and has a strong clinical focus. We use lots of real life scenarios, and we discuss lots of topical issues. But I think one of the key strengths of the programme is that it's completely flexible online learning. So it's suitable for a wide variety of groups of learners. It can be accessed as a full PGCert or a standalone CPD modules, so you can try a suck it and see pathway if you like, where you take one unit and then see how that goes and then register for the next unit. But overall, the PGCert can be completed in 9 months, so it'll take 9 months to get through that programme. And what we're seeking to create really is a worldwide community of practice where we learn together and from each other. Entry requirements, you can see their primary medical degree or other registered healthcare or social work or professional qualification, an upper second class degree in a subject allied to medicine or health education. But again, you know, access to the programme is completely flexible, so we're willing to accept accreditation for prior experiential learning or learning that has taken place in another environment if that's certificated. So please, you know, if you fall out with that category, please do seek further advice from Xavier or one of the team with regards to whether we can accept your application or not. We are seeking to be very inclusive in our approach. So thinking about how you might boost your career with this programme, we're aiming to produce graduates who are able to deliver transformational learning within their workplace. And that transformational teaching approach requires the ability to be able to create those dynamic relationships with our learners to promote learning and personal growth. And that's what we're about on this programme, really. We really look to be the facilitator of learning rather than the sage on the stage. And we try to create this really effective worldwide community of practice where the emphasis and the philosophy is on learning together and from each other. And I think that probably underpins how we act as educators on the programme, but also what the kind of behaviours that we encourage in the people that come onto the programme. But essentially, this is going to play a crucial role in educating the healthcare professionals of tomorrow. I think recent announcements regarding the expansion of the current workforce, both in medicine and nursing particularly, where there's the potential for new educational pathways, maybe even apprenticeships. I think qualified educators are going to be a really valuable resource to organisations in the future. And people that hold these teaching qualifications are often considered a great asset by many employing organisations, because teaching is a key professional requirement across healthcare healthcare professionals. So who's the course for? I've said that we're aiming to be inclusive, so you would probably expect that there would be medics, nurses, midwives, dentists, pharmacists, clinical psychologists, but it also meets the needs of other allied healthcare professionals. So we do have paramedics, social workers, physiotherapists, audiologists, healthcare researchers, speech and language therapists, clinical scientists. All of these people that come onto the programme allow us to make this programme richer than it would be whether it focus on one group of professionals. So that brings with it, and I think it's a value added factor that, you know, we're getting to share ideas and approaches and different ways of thinking, and that's something that brings real value to our programme in particular.
Oh, thanks, Dianne. If you don't mind, I'll just add on to that, Dianne, because we've had two questions through the chat function asking about, you know, two people have posted questions saying that they're pharmacists and would our course cater for them? And the answer is certainly yes. Our course caters for all healthcare professionals, all scientists as well. And as Dianne was just saying, that is the main ethos of our course, learning from each other. We have had pharmacists take place on this course in the past, and the richness that everybody brings from their own respective fields is amazing. So please don't think that, you know, I'm not a medic, dentist or nurse, this course won't be suitable for me. It will be. There are some areas of the course where the research comes heavily from the field of medical education. So it's not that we're trying to gear it towards medics, but there are just some aspects where that is where the research sits. But throughout the course, we bring in research from all different fields: nursing, pharmacists, optometrists, dentists, physiotherapists, etc. So that's how we support the other professions. I hope that's answered the questions that were posted in the chat. Let me tell you a bit about the course structure. That's what this slide is about. You will undertake 3 units. So if you're undertaking the full PG certificate, Unit 1 is called the Reflective Educator, Unit 2 is Art and Science of Teaching, and Unit 3 is entitled Pass or Fail. So you can either take all 3, and if you pass all 3, then you'll be awarded a PGCert, or, as Dianne has already said, you can take them individually. It might be that you want to progress your CPD, you know, portfolio, and you think, I'll just do one of these units, and that's perfectly fine too. Probably, if you take that approach and you undertake one, like, you probably want to take all 3. You'll have the hunger to finish and complete the whole PGCert. You'll see on the slide, it says each 20 credit unit is completed over 11 weeks, and it's delivered in 4 elements. So within those 11 weeks, we have 4 different themes, and that's how we deliver each of the units. Normally, most of our intake comes in September, so very late August, beginning of September, that's when you'll start Unit 1. But of course, if you're undertaking these units as CPD, then you can join at any point in the programme. and you have up to 3 years to complete the full PGCert. So there is that flexibility. And just a couple of slides telling you about each of the units we offer. So in September, we start with the reflective educator. And here we look at the theory that underpins effective practice in teaching, learning and assessment. And you'll be thinking about your own role as an educator and reflect on the developments in your discipline. And also how what your identity as an educator is. You'll be reflecting on that and thinking about how your identity has evolved. And then for Unit 2, which is called the Art and Science of Teaching, we'll be thinking about the principles of curriculum design and course development, think about different ways of teaching, and also think about the curriculum in terms of interprofessional education. We all work together, so it makes sense that we all learn together as well. And the final unit is called Pass or Fail, Who Decides? So here we're thinking about assessment practices, assessment strategies, how assessment fits into the broader remit of evaluation and quality assurance. And we also touch on the impact and value of feedback, as well as how to support underperforming students. So there's plenty of stuff there within each of the 3 units. I think I'm passing back over to you, Dianne, is that right? You're on mute.
Sorry, just before I go on to this slide, I'll just pick up on one of the questions in the chat. Do you have to be in a job that involves some form of teaching? And I would suggest that it certainly helps, because what we ask you to do in probably all 3 of the units is to reflect on what you're doing already in practice, and that certainly the Art and Science of Teaching asks you to provide a video clip of your teaching practice. So whilst it doesn't necessarily stop you from joining the course, it might be that you would have to think ways around how you produce evidence in the assessments. But we could talk about that if that's something that you're particularly worried about. But I think it's worthwhile us just mentioning some of these additional unique features that form part of our course. So as a registrant on this programme, you will also have access to additional development opportunities available via the Faculty of Biology, Medicine and Health, and in particular the Pedagogy Development Programme. So within the development programmes that we offer for staff, all of the students that register on this programme will have access to those development opportunities, and they include synchronous masterclasses that you can register and attend, learning at lunch seminars, journal clubs or book clubs. So lots of activity if the course doesn't provide enough already, but the great opportunities to get involved in the wider discussions around the development and delivery of teaching in healthcare. And we have, I think this is unique to our programme as well, honorary teaching fellow opportunities on the programme once you graduate from the programme. So each year we offer 2 teaching fellow opportunities to alumni of the programme, where they can come and join the programme team for a period of 2 years and get involved in the delivery of the programme, having gained that qualification. And I think that's probably unique in the UK. And then, as I previously alluded to, because we're accredited by the Academy of Medical Educators, on successful completion of the course, and this is currently medics and dentists only at the minute, but you can have a fast track application through the Academy of Medical Educators to become a fellow of the Academy. And that's something that we get as an accredited programme through the Academy of Medical Educators.
Oh, thank you very much, Dianne, for this. That's very, very interesting. And thank you also, Bip, for the presentation as well. So it is now time to hear about, maybe to say, yes, I've seen some questions arriving in the Q&A function in the chat box. We will answer that. Maybe we'll keep some of them for the Q&A session. So before that, it is now time to hear about the students directly. And so we are very lucky to have with us Dalil, who recently graduated from this course. And when we prepared the event with Dalil, I asked her to send me some quotes and some testimonials, so you can read what she sent me. And I was very interested to see that she said that since I have limited teaching experience, this PG certificate helps me to build up a good foundation for my future career and education. And Dalil, can I ask you in what ways this PG cert helped you build up a good foundation as an educator? And if you want to tell us more about it.
Yeah, actually, when I, because back to my country, I'm a lecturer at University of Hayat in Saudi Arabia, and I was a teaching assistant in preventive dentistry department. And I just worked for like less than 9 months before pursuing my higher education. So I don't have that much experience of education, and I feel that in a good way that this course helped me to build up a good foundation for any further information that I want to build on, and even the experience to build on. And it's empower me with a lot of information regarding education, because at that time when I was working with quality and accreditation unit, which is concerned with curriculum and ensuring the teaching for each college. At that time, I was interested in education, so because of that, I choose to add this on my PhD or pursue or have a qualification in education, because as I said in my next quote, that I graduated as a dentist, so it's like to be a dentist in clinic is different than educator to educate future dentists, because your knowledge, it's not about delivering the knowledge to the student, but how to deliver those knowledge, and those or the method of delivering information or delivering education to students is missing in our undergrad, because it's basically for focus on clinical side. So this qualification helped me to know more about the method of teaching and how to understand my student more.
Thank you. If I can ask you another question, is how have you found the online format of the course?
Yeah, actually, because if it is online, this is another reason that's why I chose it, because I'm doing it along with my PhD, and you know that there is a lot of commitment to be a PhD researcher, and also working as a graduate teaching assistant or part-time in University of Manchester. So online course, it helped me to do it along with those two rules, so I can do it anytime that I want. All material and are there, so I can attend it anytime that I want. And also we have online tutorial each one day where we have time to ask and to review the material.
Okay, and how have the 3 units gone? Did you take everything in one after the other, or how did it work for you?
No, actually, I'm doing it along 2 years. So, and I didn't start with the in the same order, so it was flexible. So the first one was the art and science of teaching, which was started in November until February, and then I took the third one, which is it is about assessment.
Yeah.
And then for the next academic year, I finished with the reflective educator. So
Great.
it was flexible for me, and I feel that it was a good timing for me.
Mm-hmm. Great. Yeah, that's nice to hear. Can I ask you also, how have you been able to balance the course with your other commitments? So how long did it take? How long did you spend per week to study? And was it flexible? Did it differ from one unit to another one? Or?
Yeah, actually, for me, I set a timetable for myself. So I make specific time for this course, and I try to attend or to review all the material. And actually, I didn't work in weekends, so I do everything in weekdays, and I can do it, and I can manage to do everything. So based on like the time. Different based on the each unit, but I'm not sure how many hours it took me, but I can fit it within my timetable along with the other commitment.
And maybe last question from me. We will leave other people to ask questions as well, but I wanted to ask, would you have any advice for people who have decided or haven't yet decided to study the course?
Yeah, actually take advantages from every information you learn, because I don't know, but I don't imagine how my like future education without this qualification. I'm not saying, yeah, I don't know, but I really mean it. I really mean it, because it focus on how like the theoretical background behind the learning, adult learning theory, and how to do assessment with a student, how to ensure that your assessment is reliable, valid, and I don't know, but it's helped me a lot, and I'm excited to put everything in my teaching, and already applied some in my current teaching, and I deliver a lecture in some of the courses with my supervisor, and from scratch I applied all the information, starting from writing intended learning outcome to how to design the presentation, how because there is a lot of criteria or consideration to put when you deliver any lecture, and also it's helped me to got the fellowship rather than associate fellow for advanced higher education, because that one of the standard that focus on engaging in professional development, and what I was able to put everything that I know to like ensure that I apply this criteria.
Great, great. Well, thank you very much, Dianne. Thank you for that. I'm sure that the audience will have some other questions as well. Before we go to the Q&A, so I just want to share another testimonial from another student, Dr. James Young, who's a GP from Liverpool. And you can read, we'll leave you just a minute or two to read what he said about the course, and which I think is very complementary to what you said and what has been said so far. So when you read, and you can maybe also think about some questions that you would like to ask to the panel. So please use the Q&A function or the chat box, and we will answer the questions for you. Or, well, I mean, Dianne, Bip, and Dianne will be happy to answer the questions. So don't be shy. As I said, there's no, all questions will be valuable for everyone. And maybe we can start with a question that has arrived. So we have someone asking, and that's probably for Dianne or Bip, if I'm already working in a teaching setting, do I need to have a supervisor or mentor at work?
No, not at all. No supervisor or mentor required. I mean, obviously, it provides you with an additional opportunity if you've got somebody to go back to in your practice area to chat about some of the themes, some of the concepts that we're focusing on and discussing within the programme, but it's not a requirement.
Great, thank you. I've got another question from someone, and it's a bit linked to what Daniel was saying. So regarding the order of the units and how the rhythm to follow the course. So if you choose one unit and you want to do another, would you have to wait until next September to continue?
No, not really. So Unit 1 starts in September, Unit 2 starts in November, and Unit 3 starts in February. So I suppose you only have to wait till the next iteration of the unit, but you don't have to wait until the next academic year to start a unit. So it could be that you think, I'll do art and science of teaching, you could join us in November. And Dalil had alluded to the fact that you don't have to do the units in order. We've designed the course such that whichever unit you start with, you'll never fall behind. You'll never feel as if, well, I didn't cover that concept, so I won't do very well on this unit. We assume no knowledge for all 3 units, so it doesn't matter which one you start with.
Great, thank you. Thank you. Another question is for Bip or Dianne, someone asking, would you say that this course would help you gain the skills to run training and education sessions in the future? And how does it fit in with further research and education in the future? I don't know.
Yeah, I might make a start, Dianne, and then hand over to you. This course isn't just for people who are already educators. I mean, you're all professionals and you've all been students, and maybe some of you are still students, maybe some of you are teaching. So we encourage you to reflect on your path as a learner and also as an educator. And you're right, you will gain the skills in that. We cover educational research, so you'll be able to read about different types of teaching, different levels of teaching. And then we always encourage you to, whatever you've learned, to apply it and reflect on it in your own setting. And that's what's going to make you a better educator. It's not necessarily what we teach you, but it's how you apply the stuff that we cover to your own work setting. And in terms of how does it fit with further research and education, we provide you with directed reading. So you'll be exposed to educational research from not only the UK, but globally, and in many different types of professions. So not just medics, dentists, nurses, but, you know, pharmacists, physiotherapists, etc. And that will help you to sort of see what sort of research is out there already and how you can add to the body of research. I think Dalil has a hand up.
Yeah, Daniel, if you want to.
Yeah, just I didn't do any research regarding education, but I think in the future I can do it, because the course is not focused on research, but there's a lot of example of papers of papers that doing research of education. So it shows us how it should be done. But I think I will be able to do it in the future. So it doesn't mean I think there is no separate line between education and research. You can apply what you learn and put it into the research.
Yeah, and probably in terms of progression and future career pathways, this would just be the start, wouldn't it? A PGCert in medical and health education. And I think Bip alluded to a really important fact that in practice, probably, there's a lot more of interprofessional education than there is in universities. So, you know, if you think about clinical education and clinical practice, that interprofessional education approach is going to be really key moving forward. But as I said previously, the PGCert is the starting point. It's the first qualification, if you like, the first recognised qualification. You will have an opportunity to move on, irrespective of the setting, to do a PG Dip or a master's in medical and health education. Perhaps not at this university, because we don't have those pathways currently, but you could APEL your PGCert that you undertake at Manchester and claim the first year of a PG dip or a master's somewhere else. So there's lots of opportunities and possibilities. It's very flexible in the way that courses operate nowadays in higher education.
Thank you very much for all of you for those replies. So I had a question regarding, I'm trying to look for the course to apply on your website. Does it come under postgraduate courses? I've just shared in the chat box 2 links to the web pages. So there's one, I've put you the link directly to the PGCert Medical and Health Education online part-time web page. And I've put also the web page for all the online and blended courses offered that we have at the University of Manchester. I've got a question from Kevin, who asked, so he's working in tobacco addiction as a behavioral psychologist, and he will be teaching patients about the harms of tobacco consumption. So does this still count as teaching, have students per se? Maybe for Dianne?
It would count as teaching. I think what you'd perhaps have to ask yourself is, this course is primarily designed for people that teach healthcare professionals rather than patients. There will be some of this that would naturally apply to teaching in whatever setting. But a lot of this, particularly the assessment and feedback unit, would be more around teaching healthcare professionals. What do you think, Bip?
Yes, I agree. In terms of your question, Kevin, to do with teaching for the video evidence, it would count, that would count, because we don't discriminate between our learners. Whether the learner is undergraduate, postgraduate, or a patient, it doesn't matter to us, so long as they are a learner. So in those terms, yes, that would still count for the video evidence. But do have a think about what Dianne said. This course is primarily for people who will be educating future healthcare scientists or professionals rather than patients.
Thank you. Thank you. We have another question regarding assessment. So how are the units assessed?
Can I answer this question?
Go ahead, Dalil.
Yeah. So for each assessment, there's a formative and a summative assessment. The formative one will be, first it was like for after each element. So for each unit, there are 4 elements. So at the beginning was there is a formative assessment or formative assessment to submit after each element, and then it changed to after 2 elements. And there is another one which is the final assessment, which there is 100% of it at the end of each unit. So for the formative assessment, there is no any grade or a score, but for me, I thought it's helpful because I receive a feedback on it, and it helped me to make sure that I am on the right track. And for the final one, it's depend on the unit. So for 2 units, there was it's like a essay. You write around 700 to 1,000 about each element. And for art and science teaching, there is like you record 10 minutes of your education along with you write how you want to deliver this teaching, if that
That's
makes
right, Dale. Yes. What what you're trying to say, I think, is that, you know, we have a variety of assessments, and you're quite right in saying that we have lots of opportunity for formative assignments, so people can have a go at the actual assessment question and then get feedback from their peers, get feedback from staff as well, to make sure that you are on the right line. So when you do come to submit the final summative assignment, which will be marked, and that mark counts, you can reflect on all the feedback that you've gathered and make sure that your work is the best you can possibly make it. And Delia was also saying that we have a variety of assessments. We have a blog for the reflective educator. We ask you to write an academic blog. For the Art and Science of Teaching, you're quite right, we do a 10-minute teaching video, and we ask you to submit some tutor notes alongside it. And for the final unit, Pass or Fail, we ask you to undertake sort of like an academic scientific essay. So we're drawing on different skill sets that you have and, you know, trying to develop them.
Great, thank you, Bip, for this compliment, and thank you, Dalil, as well. So we have a question regarding scholarships for past University of Manchester students. So there's no scholarship per se, but there is an alumni discount of 5%. So if you have previously graduated from the University of Manchester, you can receive a 5% discount on your course fees for that. We have a question as well regarding the closing date for application to start in September. So the closing date will be the 21st of August. So, but applications are open now, and I would really invite you to secure your place on the course. I strongly recommend to apply sooner than later because it's a popular course. So yes. I don't know, let me check, another question arrived. Yes, regarding the requirements to apply for the course, is OET accepted as an English language fluency proof? So occupation and English test for physicians, I mean. I don't know if Dianne, you have information about that, or
I'm not aware specifically about that test, but what I can say is that each application is looked on individually, and if that equates to our requirements for a score of, I think it's about 6 or above on the other tests, and it equally applies, then that would be acceptable. So we do try to be flexible and not be really prescriptive in terms of what tests demonstrate English capability. If that, does that answer your question, maybe?
I think so, yes. What I would, maybe if I could add, yes, it is actually quite flexible, and once you have apply, I would encourage you, anyone who's interested in the course, to apply and then to upload all the documents you have, especially regarding the English language test. Our admissions teams will review all the documents, and if they have any questions, they will contact you and ask and inform you about what would help your applications or not. Regarding English language tests, I know they can provide you also some links for and to provide you free language tests if the documents you have shown are not satisfying for them. So. Yes, so one of our attendees is still struggling to find the course on your online portal, so maybe I could just share quickly the, I don't know.
Okay, Xavier, while you're just looking at that, I'm just looking at another question in the chat
Yes.
about how many places we have available for each intake.
Yes.
So just to let people aware that each cohort is 120 students, but actually that's a rolling programme. So there's probably less than 30 places available, I think, currently. That's my understanding, looking at the figures. So I would urge people to apply as soon as possible if they want to start in September. Probably more flexibility for the November and February intake if you want to do a CPD route, and that's a possibility if you miss that application deadline for September. But if you're wanting to do the full programme from September to May and complete in May, then I would strongly recommend that people get their applications in as soon as possible.
Thank you, Dianne. So you have, I think you can see on the shared screen. So the web page for the PGCert Medical and Health Education. So once you're on the web page, you have Contact Us, Apply Now, and you can start your application with this button. So I hope it's clear. I've put the link in the chat box, so you will be able to view that from there. Just have we done through the questions? I think so. We have one question regarding the fees. So you can see that on the web page that the fees, it's £5,000 for the full PGCert, or £1,667 per unit if you decide to go to take it unit by unit. So yeah.
And I understand that you can pay in stages, but to be honest, as academics, we don't get involved in that side of things, collecting money. We just deliver the program to the quality that we're expected to. But yeah, I would imagine that another member of the team, perhaps Xavier, you could find out and then get back to that person about that.
Definitely. I can say that yes, you can pay by installments. So there are 3 installments. So you can pay. You will pay when you start the course, when you register for the course in September. There's another installment in February, and the last one is in May. So so it's possible to pay in 3 times. So yeah. So I'm conscious of the time, so I think we have arrived at the end. I don't think I've missed any questions there. So just a last question maybe. If I start in November, then continue until May, can I complete it next September? So I think, yeah, it's exactly what Dalil has done, I understood. So yes, it is possible. Yes.
Xavier, I think I'm probably reading into this question, but just to say that if you started in November, you wouldn't actually complete until the November afterwards, because there's a gap between May and September. There's no unit that runs between May and September, so there would be a gap before starting again in September and continuing till November the year after in the next academic year.
Great, thank you. Well, thank you very much all for all those interesting questions. Thank you very much, Dianne, Bip, and Dalil, for providing valuable and very, very good answers. I think that has been very useful for our applicants. We have arrived at the end of our event, so I'm just launching a quick poll to our attendees. So please feel free to fill that in. If you would like to arrange a consultation, do not hesitate to select yes to the question. I will send a note to you and we can talk on Zoom or over the phone. So as we said, applications are now open for the next intake, and to secure your place on the course, we strongly recommend that you apply sooner rather than later. So feel free to get in touch about how to apply, or if you have any further question, you can email me. So I just put back the slide. So you can email me at this email address, studyonline@manchester.ac.uk, and I will be happy to help further. So thank you again. We will finish here for today. Thank you all, and we hope to see you starting the course soon. Bye.